Hi, my name is Michelle.
Hi, my name is NhuHao.
And we are here to provide some answers to your burning questions for our female patients. So before we begin into our video, we just wanted to give a little background about what we do here in the clinic. I am the marketing manager here, and I overlook our website as well as other technology platforms like our YouTube channel and assist with our surgery coordinator as well. So NhuHao is our project coordinator, and she'll introduce a little bit about herself.
At Tran Plastic Surgery, I assist Dr. Tran with clinical work, seeing our patients, as well as running marketing campaign and creating contents for our blogs.
So we are here today to just provide some of the answers that we've been receiving a lot from our female patients, and we just wanted to shed some light on this topic that we think is very important for all women out there to understand as we grow older and as we go through phases in our lifetime like childbirth, and the conditions that come with the changes in our bodies are completely normal. So we just wanted to just take some time to answer your questions.
Exactly. This topic, talking about vagina,
okay. The V word.
Yeah, the V word. This topic, talking about vaginal health, it's been made such a taboo that people don't talk about. It's an embarrassment to even have. I'm sure recently you've heard the word vaginal rejuvenation thrown around on social media, in music, videos, and talk shows. A lot of celebrities nowadays actually started opening up and kind of disclose a little bit of the procedure, different technique and treatment they sought out for themselves to improve their life.
It looks like a little beautiful peach. When I tell you that I have, my yoni is like a 16-year-old, I'm not kidding.
So I had no idea that Jada Smith actually got the procedure, which is really encouraging to hear from someone, you know, of her caliber, and she's still open to talking about it, and we actually felt encouraged to, you know, just address some of the questions that we didn't know before, you know, but we kind of ran over these questions with our own doctor, Dr. Tran, that we work here with in the clinic, and he was able to provide some of the answers that we're going to cover right now.
Exactly. So, vaginal rejuvenation. It's not just as simple as making your vagina younger. It's actually associated with medical conditions, often known as urinary incontinence. It's a medical conditions where women often leak, or they cannot control their bladder. They experience leakage through stress, physical stress, or urges that can't be controlled. In order to understand fully, we're gonna split it into two parts. So the medical part with urinary incontinence, and also the cosmetic part. Certain life events that happen, like Michelle mentioned earlier, can affect the physical structure of the vagina and also how it actually looks. Often women seek out treatment to improve the comfort, the sensation, and also the cosmetic side of the vagina.
So the first question that we have is, can your vagina get stretched?
Alright, very interesting question, and I'm sure a lot of people would be curious about. In fact, it can be stretched, but it's not necessarily supposed to stay stretched. Through childbirth, the vagina has to expand enough for the baby to come out, but normally it would shrink back to its normal size. However, different conditions like having weakened pelvic floor, which is the muscle holding all your organs up. If the muscle is weakened, it can prolapse and all the organs pushing down, and which push down onto the bladder, and that would cause leakage, stretching the vagina out. And next question from Michelle: how does the vagina change during menopause?
So for most women going through premenopause and postmenopause phases, the amount of estrogen actually decreases in your body, and this actually causes less blood supply going to your area, which, you know, ultimately causes a thinning in the lining of your vagina, and this actually causes it to be more pale and just more tender over time. And this actually can cause discomfort, you know, through intercourse or just through application of medication to the area.
Is that what causes the dryness?
So actually, because there's less estrogen to the area and there's a thinning of the tissue there, it actually does cause the dryness in the area as well. And if you're, for younger patients, if you're using birth control or any contraceptives, it actually does play a part in this as well. However, we do provide treatments to help with lubrication through our different treatments and different procedures using devices that will actually help with estrogen production as well, and this will help restore the tissue over time.
Yeah, I'm glad that you mentioned that. With our new treatment, we actually have a new technology that uses radio frequency, strengthening the pelvic floor that I mentioned earlier, which help with urinary incontinence, and it's actually stimulate the collagen productions, which would help with rejuvenating the tissues.
That's amazing. Now we're going to jump into our next portion, and we're going to discuss more in depth about urinary incontinence.
So what is urinary incontinence? As I mentioned earlier, for women, there's two most common types of urinary incontinence, separated by stress incontinence and urge incontinence. Some women actually experience mixed incontinence as well, which is of course a mixture of both the triggers and the symptoms from stress and urge incontinence. Stress incontinence can be triggered by physical actions such as sneezing, laughing, coughing, which would cause the leakage. And urge incontinence usually associated with patient having a strong urge to use the bathroom frequently throughout the day, and every time they go, not much comes out. If you want to know more about different type of urinary incontinence and what causes them, feel free to check out our blog on tranplastic.com, link down below, to read more about the treatment, about the type, causes. All resources are there for you.
Perfect. Can you let us know a little bit about what causes urinary incontinence?
Yeah, as mentioned earlier, different life events can cause the body to develop urinary incontinence. These causes include childbirth, weight gain, aging, and also previous surgeries that could damage the nerves around the area, which usually would associate with urge incontinence. I know, that sounds scary, right? That make me feel like anyone could have incontinence. So Michelle, can you let us know a little more if urinary incontinence a normal part of aging?
So urinary incontinence is actually not a part of aging. It's not mandatory, it doesn't come with age, but the risk factors do increase as we age. And this can be from many, many different common causes, including the loss of estrogen as you age, and different use of medications, physical and mental activities, and disabilities that come as we age and as we grow older. These risk factors do increase, and it doesn't have to be this way. Urinary incontinence does happen to one out of 3 women, and it's completely normal. It's something that we sometimes struggle with, and it's okay. And we're here to just provide you with the right solution to help you move past that, so that you don't have to live with this kind of condition.
Funny, right? It's not a normal part of aging, but yet it's very, very common.
So there are actually a few things you can do to prevent this condition that sometimes happens when we age and grow older. And some of these include Kegel exercises. If you've heard about that before, it's something that your doctor normally recommends when you go through childbirth and pregnancy. It's something that's highly recommended for women to do before, during, and after pregnancy. And this actually helps to strengthen the pelvic floor muscles. So, not everyone is perfect, and more people than you know actually forget to do this during their pregnancy.
Childbirth is a big deal.
Yeah, for sure. And I know there's a lot of excitement going on, and so it's easy to forget sometimes to do these exercises. So, luckily we have a treatment that can help out with that, and it'll restore everything for you so that you can feel youthful again, and you can, truly exert that sort of energy out to your kids, to whoever it is that is around you. And that's, what we talk about with strengthening relationships around you as well as your confidence. So talking about pregnancy and giving birth to a child, there are a lot of things that go on with your body throughout these changes and this process. And a lot of questions that we usually get from women is, does getting a cesarean section, reduce the risk of incontinence? With getting cesarean section, it does, sometimes your body goes through changes that actually with giving birth to like maybe a bigger baby or maybe a bigger child, or when you get rips and tears down there, certain times certain things like that happen. And this is a condition that could happen after that sort of process goes on with your body. So women who actually go through cesarean section over vaginally will have a less risk of incontinence, but it doesn't mean that it won't come with age in the future. If you are at risk for any of these situations, please talk to your doctor and they can clarify more of what are the causes from your incontinence. So what are the impacts of urinary incontinence?
The impact of urinary incontinence is not life-threatening. However, it is quality of life threatening. So for quality of life, it's separated into 6 main categories. Of course, the first is physical activity. With urinary incontinence, you would be limited to certain type of activities that you'd be comfortable performing. So just thinking about doing yoga, jumping, biking, it would sound scary. I love yoga too, and that would be a big sacrifice.
Yeah.
The second, psychological, can be detrimental because young women can have urinary incontinence after childbirth, and it makes them feel like older, much older than the actual age, and that would increase sadness, depression. There's a lot of risk associated with psychological factors. Third, it's social. With urinary incontinence, you always have to find your way out to go to the bathroom. It's hard to go out with your friends or be confident because you always have to think of your next visit to the bathroom. And fourth is domestic. This would limit your freedom. A lot of patients who want to travel, they would often have to bring a lot of pads, always have to wear them and bring them in their purse in case if they leak, and it's not fun.
That doesn't sound fun at all.
Fifth is occupational. Statistically proven that patients with urinary incontinence have a reduced rate of being employed. Last but not least is sexual. With urinary incontinence, a lot of women would be terrified to go anywhere close to enjoy themselves, not only if it's leaking, but also just having little symptoms of it would decrease the sensations, reduce your chances of reaching orgasm, and it overall would not be the best version that we would comfortably or want for ourselves.
Right.
As we come closer to the end of our video, I want to let you all know that if there's any question that we haven't addressed, feel free to reach out to us through any of our social platforms. Go ahead and watch our previous video where Dr. Tran, a plastic surgeon, triple board certified, explained a little more to you about the treatment, the technology behind it. Is definitely effective, and it's only a one-time treatment.
Hydrogen cooling material.
Yes, exactly. So much great stuff that you can check out. Also, if there's any question that we haven't addressed earlier throughout this video, feel free to reach out to us and let us know.
Yes, so also subscribe to our channel if you haven't already. We would love to hear down below in the comments just what you would like to see more content of and just any topics that we can talk about. Our goal is to always educate our patients and to further spread the word. Also, we have an early bird special for our patients who are just ready to get going with this treatment. We already have it in our clinic, and so we're excited to provide the right solution for our patients who are dealing with these medical conditions, and we would love to see you in our office. We're glad that you're able to join us for our video today and hope to see you next time.
Bye!